Traumatic injury of the elbow characterized by elbow dislocation, radial head fracture, and coronary fracture. Radial head primary registered posterior lateral rotator instability. Secondary valgus stabilizer. Forearm in neutral rotation, lateral rotation of articular margin devoid of cartilage. Roughly between radial styloid and listed tubercle. Roughly between radial styloid and listed tubercle. Coronary process provides an anterior and varus buttress to humeral joint. Resist posterior subluxation beyond 30 degrees of flexion. Fracture fragment typically has some anterior capsule attached, useful in repair. Middle collateral ligament, three component anterior bundle, posterior bundle, and transverse ligament. Anterior bundle most important to stability, illustrated to valgus and posterior medial rotatory instability inserts on sublime tubercle anteromedial facet of the coronoid. Anterior band, posterior band, anterior band, posterior band, ligament of copper, transverse ligament of copper. Lateral collateral ligament inserts on supinator crest distal to lesser sigmoid notch. Primary resistance to posterior lateral rotatory instability. Four components can injured, usually avulsed of lateral condyle. Lateral ulnar collateral ligament. Most important for stability is lateral ulnar collateral ligament. Lateral ulnar collateral ligament. Most important for stability. Radial collateral ligament. Annular ligament. Accessory collateral ligament. Full on extended arm. A combination of valgus, axial, and posterior lateral rotatory force produces posterior lateral dislocation. Radial collateral ligament, annular ligament, accessory collateral ligament, and lateral ulnar collateral ligament. Structure of elbow fail from lateral to medial is lateral collateral disrupted first, the anterior capsule injured next, then medial collateral ligament disruption. Symptom pain, clicking and locking with elbow in extension. Clicking and locking with elbow in extension. Examination, varus valgus instability, posterior lateral pivot shift instability, distal radio ulnar stability, joint injury. SX loprosity injury. Concentricity of ulnohumeral and radiocapitular joint. Line draw through center of radial neck should intersect the center of patellum regardless of radiographic projection. Lateral radiograph coronoid fracture, pre-reduction, post-reduction film. Film of wrist and forearm, distal radioulnar joint, SX loprosity injury. Better evaluation of coronoid fracture by CT, 3D imaging for determining fracture line propagation.